Hey guys, it's Kelly. I hope you're doing well. I wanted to touch base quickly here about some protocols for Invisalign patients. I know many of you guys are busy being back in office after Governor Northam issued the okay to regain elective procedures in practice again. With that being said, I know your priority is definitely on PP and keeping your staff and patients healthy. And I wanted to go over a few protocols for your active Invisalign patients. So we're going to break it down into three subsets. One being patients that had just started treatment. We had a couple thousand of patients start Invisalign treatment during this coronavirus, which is pretty awesome. It goes to show that the demand is still out there. Two are patients that are midway through treatment, what to do with those patients. And three, those patients that are at the end of the road with their treatment, how do we get them retention? A side note here, you're going to notice that many of these protocols are going to be virtually based using teledentistry platforms. The reason being for that is because I know many of you guys have to put layers on protective equipment, which is not only timely, but is also costly. So a lot of the advantages that come with using clear aligner therapy is that it's very digitally based. So you don't have to see patients as often, which saves you guys during this time, save you guys time and money during this time and safety, which is great. So you're able to continue that care with your patients without having to bring them in the office by using some of those teledentistry platforms. So the first step are those patients that are currently in just started Invisalign treatment. So if they don't have IPR attachments for the first couple of aligners, you can directly send those aligners home to them. So you can change the UPS location, ship it home to them, and have them start with their first couple of aligners. Once they get that box shipped home to them, set up a smile consult with them. It's a free Zoom platform. If you're not signed up for it already, I can help you do that. Invisalign's offering it to all of the dentists that work with us. Jump on a quick call with them, have them pop in the aligners, check and make sure they fit, and progress them through the treatment like you normally would without having to see them. The second group of patients are those patients that just started treatment and they have IPR attachments planned for those first aligners. That patient can, one, either come into the office if they feel comfortable, or two, if they do not feel comfortable, you can hold them in retention, so hold them in that first aligner without getting the IPR attachments for up to 3 weeks. When 3 weeks comes around, have them offer them to come back into the office to get the IPR attachments. If they still do not want to do that, you can order an additional aligner to hold them in that first aligner until they feel comfortable continuing on with treatment. The second group of patients are those patients that are midway through treatment. If they're tracking and progressing fine, keep them going with treatment by just checking in with them using the Smile Consult or virtual care platform. Again, Smile Consult is a quick Zoom call. I can show you a basic touch up with those patients, having an outline for that if you need it. And virtual care is being rolled out to several doctors right now. We have about 2,000 doctors enrolled with it. It's really neat software that uses algorithms to show the patient or to communicate with the patient if they're on track with treatment, that can help you keep them on track without having to see the patient. So definitely enroll into these two and keep the patient progressing with treatment if they are having no problems by just touching in with them with teledentistry platforms. The second group of patients are midway through treatment and they're off track. What you're going to do is you're going to bring that patient in and have them rescan and submit for a refinement. So rescan, submit that patient for a refinement, and then send them those aligners to their house so that they can regain their treatment and get back on track. If they do not want to come back into the office and they are off track, just hold them in that aligner that they're in that fits properly so that their teeth are stationary until they're able to come in for that scan again. The third group of patients are patients that are done with treatment. They look good, they like their teeth movement, they're happy with the result, and they're ready for retention. You can make retention without having them come into the office. The way you can do this is by selecting use last aligner segment to create Vivera retainer. So what that is going to do is going to create a Vivera retainer for the patient based off of the end of their ClinCheck results. So basically, the patient's going to be able to get the Vivera. You can send it straight home to them. They don't have to come into the office, and they're happily done and with treatment without having to see the dentist again, and they're on their way to keeping their straight teeth. The second group are you can have them come in. You can scan them again and then issue Vivera as normal if they feel comfortable with doing that as well. As you can see, many of these options are virtually based in order to help keep you safe and help you guys effectively maximize your time and your money with spending the extra money on precautionary face masks and stuff like that. So you don't have to do that with these patients. You can really utilize that virtual platforms to be able to continue that care without having the patient come in. So if you need help with a specific patient or would like to learn how you can utilize some of those virtual platforms that are free of charge for you guys, please feel free to give me a call. I'm working virtually for the time being, but I want to be able to best help support you guys during this time, and I look forward to talking to you. I'm going to try to touch base with everyone, and I hope you guys are happy and healthy moving forward. Thanks.